So hello, welcome. My name's Beck. I'm the Director of Psychology and Psychotherapy for SLAM. Thanks for joining this broadcast. The series is all about psychological resilience building, and it aims to look at the fantastic work that's being done in our communities to support people with mental health problems, but also to prevent the development of mental health problems. And the work of psychologists and psychotherapists in assisting with that and supporting that. And we've seen a whole range of people in the broadcasts and services that they provide. And today we're going to do something a little different. We're going to talk about social care, because as we all know, health and social care are intimately related and one cannot function without the other. And we have the good fortune to talk to Carla Fourie, who's the Director of Social Care for SLAM, and hopefully we will also have some other participants joining us shortly. And we will then be able to explore a little bit more from their perspective as well. So with no further ado, Carla, would you just like to say a few words about who you are?
Thank you so much, Al, for inviting me. I'm really delighted to join these sessions. So I'm Carla Fourie. I'm the Director of Social Care with the Trust. I started with the Trust in January, earlier this year in January. And in the meantime, obviously, I've had the pandemic as well. So it's been a very interesting introduction to South London. This role is particularly important in the Trust because I think having a social work voice at a strategic level is about ensuring that the voice of social care is around those tables where decisions are made, and around those tables where discussions are taking place about how we work together with our partners. So yeah, I'm delighted to join you today.
And that's so important, isn't it? Thanks for highlighting that, Carla. And just to focus a little bit on why that's so important. We're obviously in the context of the long-term plan for mental health, which is all about moving resources further upstream, helping us all to think how we can provide our services in different sorts of ways to prevent people from becoming unwell, and to work much more closely with other kinds of provider to do that work. And today we wanted to focus a little bit on something that the pandemic has highlighted, which is, I think, how very difficult it is for staff on the front line, staff who are in our ICUs, who are having to deal with an awful lot of very, very sick people, but also people on the front line of social care, people in social, in supported housing of one kind or another, who are finding themselves in a really, facing equally distressing situations, and we need to think about how we can support those staff. And I know that's something that will be very important to many clinicians in secondary mental health care. So if I could start maybe by asking you a little bit about what use people who use secondary mental health care, so the service users of secondary mental health care, what use do they make of social care provision? Can you help us understand how the two are related?
Right. I think the first thing to say when we talk about social care, it's such a broad kind of concept. It's a kind of a umbrella term that kind of refers to a wide range of organisations and professionals working in social care. And when you talk to perhaps the man on the street, people have different kind of visions or ideas of what social care is. I recently had a conversation with someone that's not that familiar to kind of the more statutory kind of side of things, or even, how health and social care work. And they would say, well, I suppose those are the social workers who work with children and, perhaps remove children from families, or are those the people who help, homeless people? So there's various kind of perceptions of what social care does. As I kind of mentioned, it is a very kind of wide sector, so it covers anything from providing social services through kind of workforce such as social workers, but in social care you also have other professions such as nurses and OTs also working. Then social care is not just perhaps within what we think is within local authorities. You have social care provision in the wider sense. So social care can be provided in different settings. So it can be provided in people's own home through domiciliary kind of support, helping people to be independent by doing kind of practical stuff like getting people up in the mornings, making sure that they are able to take their medication, helping people, to wash, and sometimes kind of even personal care. So it could happen in someone's home, and it's provided through a particular workforce, but it can be in care homes and in residential care, etc. So very wide. And again, you could provide social care services in children's, in adult services, learning disabilities, physical disabilities, and where we work in mental health. And the things that social care does is, and particularly local authorities, if we refer back to local authorities, are providing information and advice, assessing people's needs, and then supporting people to live as independent and full lives as possible, like us as any citizen. So a very broad concept. And our social workers in the trust is one part of those kind of thousands of social care staff working across, like I said, from being social workers, but right through to being kind of social care staff who perhaps don't have a particular social work qualification and are often seen more in a support worker type role. Again, kind of different kind of perception. So a very wide sense, and I think people benefit from it in secondary services because it takes account of people's wider lives, so those social determinants that impact on people's lives, such as their housing, the environment they live in, kind of their family and community connections. So it's looking at those broader things and helping people with those broader parts and the practical help that people need to live independently. And health will, I think, we will probably fall over to kind of say that if we do not kind of have social care to work in collaboration of. And then just a final point, I think a very important informal workforce, if you want to refer to them, are those unpaid carers, the families and carers and neighbours that provide that type of support. For people. There are over 6 million carers in the country, and again, which is kind of larger than your whole health and social care workforce together. So a very broad sense. I hope.
Yeah, thank you for that.
Russell, stop there.
Yeah, thank you for that overview of social care. And I wanted to ask you a little bit more. So you've talked about many of the people who use our services using these social care options, of which you've described quite a varied amount. But do you have a sense of what the interdependency is of health and social care? So, for example, how many of the people who use our services would really be relying on social care for accommodation, for example, or for support once they left, or indeed to help prevent them from becoming unwell again? Do you have a sort of sense of the number and the sorts of pathways?
Well, if we look at what research says, when we look at people's kind of recovery, kind of health recovery, is that about 10 to 15% are related to those kind of medical treatments that are provided to people. The vast majority, so that's 75, 85% or more, are related to people's social circumstances and people's social care needs. So, so there is definitely that kind of interrelatedness. So we won't be able, for example, to discharge people safely from our kind of inpatient settings back into the community without having kind of social care support there, whether it is through a provision within, like I said, their own homes, and perhaps through personalised kind of care package, or whether it is where people's needs are so complex and so high that they need some form of supported accommodation or residential care. And there I'm thinking also particularly on people perhaps with, say, dementias, or people with really complex needs, some of our people with learning disabilities and mental health and dual diagnosis. Without that interrelatedness, we won't be able first to kind of discharge people safely, but also maintain people independent within the community. So it is like, you know, hand in glove, really, in terms of health and social care needing to work so much closer together, but also in terms of the other contribution that social care provides in terms of bringing a strengths-based approach, having understanding of the strengths that people have, building on that and not necessarily just looking on the deficit side, enabling people to access maybe further wider networks within their community and creating a sense of connectedness for people. And it's those kind of type of approaches and interventions is as important as those actual, you know, kind of commissioned paid type of services that people need to maintain their health and their well-being. So like I said, that's why when we look at, you know, all kind of policy directions and the new community mental health framework, it all talks about breaking down those silos, breaking down those barriers between health, social care and the third sector, and making sure that we get the best outcomes for people.
And so when we're thinking, Carla, about the support needs of staff working in these really difficult environments that you've described, because it's not just, is it, that you know, the huge amount of support that they provide to service users, but some of that work is really, really difficult. Can you tell us a little bit about some of the things that have come up during the pandemic that have maybe highlighted the difficult work that you have rightly highlighted that social care staff do in the community to help the people who use our services not become ill? And I don't mean with COVID, I mean with mental health problems, but also hopefully with COVID, and also to support them as they leave hospital.
Yeah, I think COVID has particularly amplified, you know, particularly the social care sector of care workers, social care workers working within our care homes, residential and nursing care homes. And we know that was at the onset of the pandemic, it was, you know, really highlighted through the media as well, and highlighting the concerns for those staff working in residential care homes. They were concerned, one, about the, you know, very kind of the safety aspect. Is it safe? Have they had enough, you know, and timely access to PPE? We know what the headlines were around that. You know, that they felt they weren't supported, that they were kind of the last in line to be recognised. We all remember the Thursday hand clapping for the NHS, and then very soon the social care sector came on board and said, but please do not forget social care, the social workers, the social care workers, because they are often forgotten. And I think for COVID, in a very strange kind of perverse sense, have highlighted particularly that sector for many years that has been underfunded, and for staff who are very low paid jobs, often have perhaps two jobs that they try and kind of manage, have their own kind of stresses. And the piece of work, Elle, that you've kind of led on looking, also speaking to a number of registered care home managers and with care home staff, have highlighted the impact of working with people where, and we know there was a great number of deaths in sadly within our care homes, and the impact that has had on people dealing with those bereavements, having worked and supported someone for such a long time. And there's been great stories coming, forward from care workers even moving into the residential settings, trying to support people. They've really walked the extra mile. But the feedback that we've got, and the feedback, in the interviews you've had with some of those staff, highlighted kind of the stress that they've had, and what they would have valued are those kind of respectful kind of acknowledgements of the contribution that they make, those kind of practical support that they need. And I think what I've seen from us as a trust during this time, we've got our kind of existing kind of longer term, I think it's not rehab, recovery teams, and where we do have those teams in place, I know that the staff there has been really in close contact with supporting, the homes through the service users that we have there, because we've got huge amounts of our people who use secondary services that are placed within our care homes, and we were able to offer that kind of distance type of support, advice on PPE and that kind of support, but it is not across all the kind of systems, and this is highlights the work that we've maybe done in mental health, but it's such broader. And we know that people within the care sector are, and that's a sense fragile in terms of, if they don't kind of be bolstered up and kind of build in kind of the resilience that we need to kind of, help build within that sector.
So we heard, and you referred to the care home review that we've been looking at, and that has revealed some very interesting findings. Talking to lots of registered care home managers, they say they felt very put upon by health, that they've been expected to simply take people discharged from hospital without clarity about whether or not they're positive, and without the capacity to manage that. Because they don't have the luxury of being able to cohort their residents or keep people safe in the same way. I was just wondering, using that as a sort of launch pad, if you could talk a little more about what you think health might provide to social care to enable a better working relationship. And I know we started this process thinking, how can we support the staff? And I know that will interest psychologists and psychotherapists, because that's obviously the sort of area, providing reflective spaces, opportunities for people to look at the emotional impact of the work that they're doing. Could you talk about whether you think that's suitable or not suitable? Where are we at with what can health do at this point?
So I think in sense of the kind of wider health, if we think about primary care, etc., it's making sure that, anyone that's on the books and are providing, that kind of care work or any, of those kind of helping professions, to be aware of that and to be aware of the impact of what I refer to as kind of secondary trauma for people working in those sectors. So I think it's that kind of awareness and making sure that your areas such as IAPT and other type of counselling support are available to staff. I think for us, where we work very closely with the teams that support people in our services, it's important through, for example, one of the kind of good practice examples that are kind of highlighted here around those longer term recovery teams, to be kind of acknowledging and working with those care homes and care workers, because those are the people who know those service users often better than kind of we do as well. Some of the things that seem to have worked, and I think that would be good, is to have perhaps some kind of training sessions for some of those kind of care staff. And I know some of our nursing and psychology staff has been into some of our mental health homes and provided kind of sessions on perhaps challenging behaviour and kind of all those type of in-reach kind of stuff, kind of training and support. I think wider from a kind of employment point of view, I think we need to recognise that we work as one system. Of course, there are different funding pots, but there are opportunities to think about, can we have some kind of joint recruitment and workforce development kind of opportunities kind of across the health and kind of care sector. So I think those things that you have mentioned as well are like having reflective time. I know that our local authority partners have register care home manager kind of forums and meetings with kind of care homes. Again, you know, that could be opportunities to really engage kind of with the managers, because if you enable kind of managers, you know, the staff that they support need to feel that they can, you know, approach kind of the, you know, their managers, and that there are support out there for them.
And can you tell us a little bit, we've had a question from the audience about the demographic of the social care staff, and particularly noticing the backgrounds that we have actually for this presentation. And I think it's a really valid point. I think, well, I'll ask you to reflect on it, because it's and it, you know, it is striking.
It is very striking, and I think, you know, again, referring back to the piece of work that we've been doing with the care homes, one of the significant kind of messages that came out there and that was striking is around staff from BAME backgrounds. Again, we know the statistics around just from COVID, that people are more susceptible and, you know, and at risk of contracting kind of COVID. And it's about the practical things that employers can do around, like kind of doing BAME risk assessments, a bit like we've done in the trust, but that should be practiced across, I think, the sector. So yeah, I think that is very significant in terms of the demographics. I think also in terms of, you know, supporting those staff from BAME backgrounds and listening kind of to what staff have to say. I think that was one of the most valuable parts, I think, of the review that was undertaken, is that those voices were also illuminated in there. Then perhaps just another point, which I think is quite an exciting development now for us in the NHS. We've been kind of you know, quite familiar with the workforce race equality standard, which is mandatory for the NHS. That equality standard or anything similar hasn't really been there for the social care sector, and it's been very recently that it had ministerial sign-off to go ahead and develop a very similar workforce race equality standard within the social care sector. And we hope that through that mechanisms, that will also kind of improve, you know, the conditions for the BAME staff working in care homes as well.
And that seems so important, doesn't it? Because of the fact that so many social care staff who are paid often less than the London living wage, often not getting paid if they have to self-isolate anything more than the statutory sick pay, and yet doing these incredibly difficult jobs, as you describe, people who are effectively social justice champions for the people that they work with, whose presentations may be very, very complex and often quite challenging. And then also in this context of the pandemic and the massive overrepresentation of BAME people in these low paid jobs, there's something very, very wrong. There is an institutional racism that pervades our health and social care structures, isn't there, that needs to be addressed. So this does feel like a really important turning point for social care. And I'm just wondering what you think I mean, if I push you a little bit on that, where you think the first best steps would be taken to address the needs of BAME people providing social care.
Right. So I think, again, it's about making sure that it is recognised, but not in terms of a tokenistic, because often I think, people have one of two kind of responses. They immediately put out a kind of a statement to say we support kind of people from our staff from BAME backgrounds, or some kind of really awareness event is kind of launched. But it's making sure that is reflected throughout kind of the culture of the organisation, the culture within kind of care sectors, within the policies, within the training, so into kind of the fibre of those organisations.
So very much a kind of leading from the top and bottom and middle of the organisation.
And if I can pick up, I do like your kind of words that you use, the social justice champions. There is about us kind of championing and advocating, and it's something that social workers are very familiar with, and it's kind of our bread and butter. To be advocates and to be, to advocate for social justice. That's something that's, particularly for us in social work and social care, we particularly kind of focus on that right-based and human rights-based approaches as well. And again, I just want to have a final thing around also the strengths, because it's looking at the sector and the individual strengths and not just the deficits. How do we enable kind of those sectors to also come up with, the suggestions? How do we listen and work collaboratively with people? And, that is right through from where we work on a one-to-one basis across organisations, right through to integrated pathways, right through to where we work with those individuals that uses our secondary care services.
So it sounds like you're saying there's a sharing of values that can go on between the values of health, which are very much about reducing health inequalities, very much about putting people's needs first, and services being oriented to the things that people want to achieve themselves, the outcomes that matter to patients, as is often said in a value-based healthcare context. And a marrying of that with the social justice values, with the value of rights-based care and strengths models. And there's a synergy there that can go on. And we have a question from the audience here about, would you encourage the development of peer support across these two sectors? So I think that would be that's a really interesting question in terms of this values sharing, isn't it?
Indeed. Again, I know that we are very keen to increase our peer support workforce. And yes, again, it's with people with lived experiences, hearing and learning and working with people who've been there and understand what it's like, to have mental health issues and know what it's like to go through a recovery journey. And to support. So for me, the future of an integrated workforce is, we can't think about that without including the essential role of peer support workers and the third sector and the voluntary sector and all of that. So it is about, I like the way that you've put it, Al, around that kind of shared and marrying up of those values with the co-production of people with lived experience.
And finally, because we're coming to the end of the broadcast now, I wonder if you want to talk a little bit about the role of the Prevention Task Force. So this psychological resilience broadcast series sits within the framework of the Prevention Task Force, which has been doing an awful lot of work, looking at how we do integrate health and social care, but also a huge range of other providers and most importantly, community providers. Could you tell us how that's going? And for those who don't know anything about it, could you give a bit of a frame?
Right. So the task force was developed on the back of a prevention and mental health prevention and community resilience summit that was led by the Trust earlier, I think, in the summer. And one of the recommendations from the task force from that summit was this kind of set up this task force that will be across sector, cross agencies, and together with people with lived experience. And the key aim of the task force is particularly to look at how can we protect, in a way, inoculate, I think is sometimes the word you've used, Al, against kind of mental health kind of needs as a direct result of or indirect result of COVID. So it is a response to COVID. It's chaired by our own chair, Sir Norman Lamb, but also with co-chairs Jackie Dyer from Black Thrive, and then the councillor Janet Campbell from the council. And the membership includes members of the council, third sector, health, social care, lived experience, etc. And there are 6 key work streams. And what particularly delighted me as a social worker is that it kind of recognises those social determinants of mental health. And we are at a point where we've drafted the overall aims and objectives and looking at another summit in early November.
Well, it's been absolutely fabulous talking to you today, Carla. Thank you so much for sharing your thoughts, and I hope people have been really inspired by what you've said. They'll be able to get the broadcast later and listen to it if they missed anything, or if they want to forward it on to people who might be interested. Thanks again.
Most welcome. Thank you, Al. Thank you, everyone.